So I'm going to talk a little bit about a condition known as External Iliac Artery Endofibrosis, or it's often seen shortened to EIAE. This is a condition that is seen sometimes in cyclists, and the other group tends to be elderly people. So first of all, a bit of a disclaimer, I'm not a medical professional at all. I've got no medical qualifications, but I do have external iliac endofibrosis clinically diagnosed. That was done through the NHS here in the UK. First thing is a bit of a description about what it is and the wording of it. So endofibrosis is a hardening, and the iliac artery is an artery that comes down through your leg or through your hip area. This particular type of one is the external one, which is where it splits off from the others. So a few things to talk about it. First of all, what it is, and then I'll go into maybe how to diagnose it, or to at least have an idea if you have it yourself, and then details on sort of how I had mine diagnosed and the effects that it has. So first of all, it's with athletes, it's often seen in cyclists, and what tends to be the case is for people who what they think is people who sit in the same position for a long time, and that artery then gets harder and becomes affected by this condition. So what happens is with a typical normal artery, it can expand through extra blood pressure, and this allows blood flow to continue. When this particular artery gets hardened, and because of the position of it, it gets hardened through the central of the hip, this can affect the blood flow down to one or sometimes both legs. There are a few famous and well-known professional cyclists who've had it. There's also a lot of people I know personally who've got in touch and also had it. But the first person that I knew of is an Australian professional, Stuart O'Grady. More recently, Prevost. She actually had a double leg surgery done with this, which I think is a huge step to get both legs done at the same time, to get operated on at the same time. There are also a lot of amateur cyclists who have this condition, and I think there'll be a lot of people who have it and it's not diagnosed. For me personally, I recognised the first signs of the problems in about 2012. And this was showing as, first of all, a tingling in the very bottom of my feet, in my toes on the left hand side. Because it was happening during the winter, I assumed, first of all, because I knew nothing about this condition at that point, I assumed it was my shoes were too tight, because I was wearing winter boots, maybe winter socks, or would have been winter socks as well. I just thought my shoes are too tight or my straps are too tight. It was happening on interval sessions, and especially that first interval of a block. I'd get pins and needles, and I would have to either stop or I'd back out of the session. And then this led on to a time when I then was part of a celebrity challenge event, and I was the Welsh cyclist, and managed to get a doctor who had some knowledge of this condition, and he suggested that it might be this, and to go about further testing. That was way back in 2012, and it took, I think, 6 years to finally get a diagnosis. A little bit more specifically about what happens: I get a tingling in my left toes, and then if I keep pushing and keep cycling and keep the effort on, that then becomes a numbness. And it gets to a point, if I keep pushing and keep going against the pain and the boundaries, that whole left leg goes numb, and I feel like I can't keep pedaling. The worst it's happened from my memory, I can remember a race in Mongolia where the start of the last stage, I went out of the gate, flat out up the first hill, trying to go and win the stage. But before the top of the first hill, which is only a couple of hundred meters high, I was on the ground thinking, what on earth has just happened? You know, I couldn't feel my leg. I thought something major had gone wrong. I'd then went through the process of trying different insoles, different shoes, different socks, all trying to get through what I thought was a foot shoe insole problem. It wasn't until much later on then that when I started to read more into this and discover what the problems were, where I was able to get it sorted. So why it affects cyclists, I guess, is because of the position on the bike, and because certain cyclists spend a lot of time in that position. What I don't know is why it affects some people and not others, because there are some people who do huge mileage who don't get this condition, whereas for me, and I wasn't doing crazy miles back then. I was racing full time and was doing a decent maybe 20-25 hours a week, but not massive. Before that, I was a cycle courier, and I'm not sure if that had any part to play. One thing that I do look back on is I used to ride on cranks which were really big, so 180 millimeters, and for me 168 centimeters tall. It was quite a big crank length. I went down the route of thinking, well, the longer the crank, the bigger the lever, the easier or the faster I'll go. In hindsight, that appears not to be true, although I don't know if that has any impact on this condition or driven it forward at all. Although now I'll use 170s on all my bike, and my theory there is that I'm maybe slightly decreasing the leg angle on the hip on the upward part of the rotation. Again, I don't know if it has any effect, but for me, something I'm trying. I went down the road of trying to get this diagnosed and to try and see if I could have an operation to get it fixed. I stopped racing professionally at the end of 2013, but cycling still, a huge part of my life. Still cycle for a living, just don't race. And it did take quite a long time. So I am fortunate, however, I had a really good GP locally who also cycled himself. I went to see a guy, the local specialist, and he pretty much dismissed it. He said he's never seen this on anyone under 70. I don't have it. So wasn't too happy with that, although I was kind of expecting it because it's not a common condition for people who are fit and active. So went for a second referral, had some tests done. Even that then came back as inconclusive, and kept pushing and pushing. Finally went to see a specialist in Bristol who is known as a UK specialist for this condition, who was able to do some proper testing that is aimed at cyclists, not just at elderly people. And this then finally came back as a confirmed diagnosis. And I'll be honest, I broke down when he gave me the diagnosis, because it had been sort of 6 years of wondering what the hell is wrong with me, and to finally hear then that yes, I do have this problem in my leg, it was a massive relief. From that point, I was told I can have an operation if I want it, but to this point, that's now about 2 years ago, to this point I've decided not to. The reasons for that is, firstly, I'm still able to ride, I'm still able to race. I am not racing the same races, I'm not racing at the same level that I used to, but I am still able to ride. I've modified the races I do to be more endurance, so I don't have that high power. For when I was getting the symptoms, it was all high power stuff, so FTP and above, or what was my FTP. And I'm also still able to ride, still able to enjoy cycling, just to have to modify it. I am, however, keeping an eye on it to make sure that this doesn't progress and get worse. If this gets worse, then I can go back to him and say, yes, I want this operation done. But for now, while I'm able to still ride, that's a decision I've made. Also then, I know people who've had the operation done, and it's either only been partially successful or hasn't been successful at all. And that is also something that is a concern. So until I can't race at all, perhaps, I'm not going to take the risk personally. Briefly going on to this condition and how I'm able to keep riding with it. and able to monitor it, and maybe able to what might be an idea if you think that you have something like this, and to maybe start your own personal diagnosis. If I go for a ride and I'm seated on any effort, my power is significantly lower than what it will be if I am outstanding. It's not by any means a perfect example, and it could be that because I prefer to stand when I climb, that this is the case, but it could be that is a trained effect. But it might also be, and my personal thoughts is it might be that because of this condition, and when you are sat down on any effort, you're closing that hip angle, and maybe the blood can't flow any faster. So recently, using exactly the same bike, exactly the same type of effort, I could see within, I think it was only a few days apart, one big climb effort, which wasn't 100%, but it was at a power that is reasonably close to what I would consider my FTP to be. It was about 30 watts higher than the same sort of timed effort on a flat course where I'm seated almost the whole time. So for me, I think that is a big part. So I am not competitive at all on flat courses. I never have been, but I think now more so than ever, and that's my way of being able to test it and to see. So perhaps if you think you've got this, or you wanted to test it, then that might be a way of doing it. Go do an effort completely flat, completely seated, and then go for a climbed effort and see maybe if you keep your heart rate the same, so it's the same overall effort, but see if the power differs. And for me, like I said, it was quite a big difference. As things stand right now, I am comfortable and I'm happy in the amount of riding and the type of riding that I'm able to do. So I'm still able to go out and do big rides. I can still ride fairly fast. I just can't do anything that's close to and above FTP. So if I go out and do a big hill effort, this will come on usually within a minute of starting. I can keep it sub threshold and just go on for ages. So as long as I can continue to do that, I will. And if it gets worse, then I will consider having surgery again. If anyone's got any more questions about this, I know I think it was an article on Pink Bike which highlighted it, which brought a lot of people's attention to it quite recently. If anyone's got any questions that I might be able to answer myself, put a comment below, and I'll see if I can help and answer them, or at least maybe give some guidance on this. So thanks for listening. Hopefully it's been of interest to some people, and hopefully there's not too many people out there who've got the same condition as this.